researchers from the Indian Institute of Technology Madras have launched India's first indigenously developed polycentric prosthetic knee called Kadam, which aims to improve the quality of life for thousands of above knee amputees. This made in India product has been developed by IIT Madras in association with Society for Biomedical Technology and Mobility India. In an exclusive conversation with PBNS, Professor V. Kamakoti, Director of IIT Madras, and Professor Sujatha Srinivasan, Head of TTK Center for Rehabilitation, Research and Device Development at IIT Madras, tells us about the device and how it makes the life of above knee amputees easier.
Kadam is a knee it's an artificial knee for people with above knee amputations who need an artificial leg. And now the knee plays a very important role in walking and mobility in sitting down, getting up from a seated position, all that. So during walking especially, the knee has contrasting roles to play. So when there is when you're walking, when you place your weight on the leg, the knee has to be stable enough to do the weight bearing and not buckle and allow you to and make you fall. So it has to be stable in that portion of the walking cycle, and then it also has to bend and swing through comfortably so that the person can prepare for the next step and walk comfortably, because walking is a series of weight bearing, then swinging forward, weight bearing, swinging forward. So the knee has to bend in certain parts of the gait cycle. It has to be very stable and locked in certain other parts of the gait cycle for it to enable the person to walk comfortably. Now when a person has had an above knee amputation, so they lose part of the muscles also of the thigh. An above knee amputation is an amputation across the thigh bone. So they are left with a residual limb, and the length of that residual limb depends on where the surgeon cut their, depends on what their problem was. It could have been an accident, it could be cancer, it could be diabetes. There are various causes for above knee amputations. So when that happens, the length of that residual limb, what is left, that is very important, because that is the part that goes into the socket of the prosthesis. The socket houses the residual limb, and the person has to control the entire artificial leg through the residual limb, which is housed in the socket. Now the knee comes below that, and the rest of the leg, the shank and the foot come below that to make up the entire artificial leg. So the design of the knee joint becomes important because you want to give the user as much control as possible with the remaining musculature they have, and what they can do within the socket. Okay, so that becomes important. How can they control the stability and bending of the knee with whatever length of residual limb they have.
Professor Kamakoti talks about how the technology is actually changing the lives of persons with disabilities, where innovations like Kadam make their lives easier.
So the very, very touching moment for us was Sujatha's earlier invention, the standing chair. It was inaugurated, and on the inauguration, when the national anthem was sung, the persons who could not stand actually stood. Okay, so that was a very beautiful moment. I consider that as a very touching moment. Everybody had tears in their eyes, and still I have goosebumps here. Okay, so that's very nice. Ultimately, if you have if you have a small crack in your leg, how bad you feel, right? You can't wear your shoe, and right. Imagine a person without a feet, right? So that's a very good Chinese proverb. With a person was worried he did not have slippers, still he found a person without a leg. I think this is very, very important, and I'm sure Sujatha is going next. She has multiple such projects, and I'm sure this is going to change the way provide ease of living. Why does IIT exist? A lot of people ask this question, right? You're taking so much of taxpayers' money, and why do you exist? Right? We have a lot of satisfactory answers, but there are very few powerful answers. And what Sujatha has done is a very powerful answer for this. Right? This is my view about Kadam, and other lot more. You can see every year there's something she has that will come out in the same way and with the same benefit to the the physically challenged people.
With such innovations, we are assimilating technology with healthcare. The functional needs, socioeconomic and environmental challenges of Indian users are unique. Professor Sujatha explains how this device fills that gap.
So the idea of a polycentric knee was first introduced at the University of California in Berkeley by Professor Charles Radcliffe back in the late 60s, early 70s. So the idea has been around for a long time. And there are also other imported 4-bar knees in the market. But when we researched it further, we found that there was no indigenous 4-bar knee. When we researched it further, we found that, these 4-bar knees have different geometries. And each geometry behaves somewhat differently. So not all 4-bar knees are equal. So when we looked at, okay, what are the needs of Indian users? We walk on all kinds of uneven terrain. It's very rarely that we walk on level ground all the time. We walk on uneven terrain, so the control of the prosthesis in that kind of terrain is challenging. Even we stumble quite a bit, even without an artificial leg. So because it requires a lot of control. So uneven terrain is something that we encounter. Then, in a lot of cases, we sit in very cramped spaces. Like, we don't always have a lot of space to spread our legs and, sit comfortably. Autos or buses, public transport, the amount of space that you have, you have to bend your knee quite a bit to sit in those spaces. So we identified about 6 different requirements that are specifically needed for use in Indian conditions. And we looked at existing 4-bar knees, both imported and 1 or 2 that are available in India. And we looked at their geometry and we studied it, and we said, how do they meet these requirements? How well do they meet these requirements? And we found that none of them, could meet all these requirements that we had identified very successfully for use in Indian conditions. So we said, okay, let's go back to the drawing board and let's design a 4-bar knee geometry that is more suited for users in these conditions. And that is what we were able to do. That is the research that went into it and the novelty that went into it, the geometry that we came up with. We also patented that. We've patented that geometry, and we said this knee should perform better for users in Indian conditions, for all the above knee amputees who use prosthesis. And then we were, Mobility India did many user trials for us, and they validated that yes, this knee is performing better in rural areas, in peri-urban areas. They did this trials in different geographical conditions, and they came back to us. We did some improvements. They came back to us. So over a period of time, we were able to improve it, but the basic geometry we realized works very well. So some of the users, the very first time they use the knee, first they train them in parallel bars. So they hold on both sides and walk with this. Even in the very first trial, some of them, they walked on it, they were comfortable, and they said, okay, let me walk outside. I don't need the support of the parallel bars. So that told us that, we were that our hypothesis was right and that our design approach was right for Indian users. So that is sort of the novelty of the knee, and that is how it can improve the accessibility and mobility for users in Indian conditions.
Are there gaps in the need and demand for assistive technologies? Who states that only 1 in 10 people in need have access to assistive technology and they are not available in adequate numbers and at affordable prices? What stands out for Kadam is its cost-effective nature. Professor Sujatha explains to us how they are making it possible and also how it brings advanced healthcare into all those households that otherwise can't access or afford them. In addition to that, there are several challenges involved with the persons with disabilities and those who take care of them. Appropriate awareness programs are carried out by R2D2 to bridge the gap between information and the lack of awareness.
So yes, there is a huge gap between the need and the demand, because the WHO, the World Health Organization, estimates that of the people, if 10 people need assistive technology, only 1 of them has access to it. Only 1 in 10 people, so 9 out of 10 people do not have access to the appropriate assistive technology they need to live a full independent life, participate in society, have access to opportunities for learning, livelihood, and independent living. Why is there such a gap? Affordability is a huge factor. One is, of course, lack of appropriate technology. Like I said, what's available, even if you're able to afford an imported knee, for instance, it may not work very well for you. Or if it is a very high-tech knee, even if you can afford it, if something goes wrong with it, then you're stuck. You'll have to send it back to wherever you bought it from. You're probably there for months without a knee while it's getting repaired, or you will not find parts easily. So at R2D2, one of the things that we do is we first focus on developing simple products, simple mechanical products that can be easily maintained and repaired in Indian conditions. We first try to meet as many needs as possible using devices like that. Of course, eventually we will also start developing more high-tech devices that offer more functionality. But basic functionality in many cases can be provided by good mechanical devices. So the accessibility also. So many people, in India, a lot of people with disability live in rural areas. They don't have access to therapy. They don't have access to the knowledge about what devices are available. So awareness is also very poor. And so what would be the appropriate device? And in many cases, even doctors, after they do a surgery, they are not aware of what is available for the patient from that point forward. Their care ends when the patient leaves the hospital, but they don't tell them about what a difference therapy and the right devices can make in their life from this point forward. So the awareness is also very poor about what are the devices available. And of course, affordability is a major factor, because many people after their disability lose their means to livelihood. Most workplaces are not accessible. Getting to the workplace becomes a challenge. So all these play a role. Their access to educational opportunities goes down considerably. Their caregivers may have to stay back and not work in order to take care of them. So all this plays a part in in not being able to improve the quality of life for the person with disability. So all these challenges, have to be tackled. So for instance, at R2D2, we are not only now focusing on developing technology, we are also conducting awareness programs. We want to bring the word out that the other misconception is that, assistive technology means it's like one size fits all. Even in the case of wheelchairs, it's not true. If you see many people, they'll be sitting in a wheelchair that's too big for them, and they'll be like slouching, they'll have bad posture, and they will not be able to operate the wheelchair on their own. So that independence is gone, but that should not be the case. So we are now conducting awareness programs for wheelchair. How do you assess somebody to use a wheelchair? How do you prescribe a wheelchair? The concept of prescription for assistive devices is also something that is completely missing in India. How do you have custom devices? Like imagine if everybody, eyeglasses are also assistive devices, right? We use eyeglasses when our eyes are not able to function as well as they used to. And so when an eyeglass is an assistive device, suppose you give everybody the same power in the eyeglass, how useful would it be? It's the same thing with a wheelchair. It's the same thing with a prosthesis. These things have to be fit properly. People have to be trained to use them for them to make effective use of the device. So this gap between need, there's a huge need, but the demand is not being met, and also because of manufacturing constraints. See, this industry, because of the cost sensitivity, the price sensitivity, not a lot of private industry wants to get into this market because they know it's very price sensitive, and it involves a lot of training. It involves all these other aspects that they don't want to get into. It's not like you can order it on Amazon and a person can wear the prosthetic knee. No. So because that won't happen, private industry is very reluctant to do R&D in this space, or even to get into marketing in this space. That is why we try to pick suitable partners. For instance, Mobility India, they also run orthotics and prosthetics programs, bachelor's program, master's program. So they are educating people to become prosthetists and orthotists. So it's an ideal, they know how to train people in the use of these devices. And so they also conduct training programs in other parts of India and some abroad also. So I think we want to partner with people like that to try to meet this demand and to try to sort of bridge the gap between the need and demand. But this is a problem not just in India, it's all over the world. And even the WHO recognizes it and is trying to do something about it. Manufacturing is another major problem. Because these volumes, till that demand is kind of matched with the need, the volumes are relatively low. Because you're talking about a percentage of the population who needs these devices. And in disability also, there are different categories of disability. Different people need different kinds of devices. So the volumes become low. So finding good manufacturing partners who will manufacture high quality at high quality and affordable prices becomes a challenge. So these are all some of the challenges we face in getting these devices to the market and to the end user eventually.
How can government play a bigger role to solve the problems involved with the expensive manufacturing of assistive devices? Professor Sujatha talks about the startup ecosystem supported by the government as an effective approach.
The role of the government is very, very important, and the role of the government has to, so one of the things, sitting in an academic institution like IIT Madras, I am doing product development up to the manufacturing stage. So this is one of the ways that we are trying to also handle this. See, because the government can't do everything. So at least what we are trying to do is, okay, private industry will not invest in R&D. So as an academic institution, people are willing to trust me with their funds, trust us with their funds to develop this. So we take the funds from the government, from CSR, from foundations, and we try to do the R&D. In a very rigorous manner, so that it also meets the needs of the end user. Because the private industry, they are going to look at how quickly can I get this to market. So, how much time can they spend on it? How much funds can they spend on it? That's limited. The government CSR program, and that too, allowing the CSR to fund R&D in universities is a great initiative, because in a space like assistive technology, that is absolutely essential, because CSR funds, they want to see impact. So we need funds like that, where they're focused on not the bottom line, but on impact. Now, if you go to private funders, venture capitalists, they're going to see how quickly can I get a return on investment. Okay, so here we are taking grants. So, academic institutions are wonderful places to be able to leverage the grants from the government, work on various aspects of this, like the awareness creation. So we have a clinical team. We are an engineering institution, but we have now at R2D2, we have a clinical team with occupational therapists, physiotherapists, who work to create these training programs, who go to multiple places to educate, the various therapists and stakeholders and rehab professionals. We work a lot with many hospitals like CMC Vellore. We work, with private hospitals. We work with mission hospitals. We work with rehab centers. So all this collaborative effort and all are better done by universities, academic institutions, with support from the government. So the government should enable these things, and the government should also start supporting more startups in this area. Buy their products. If the products are good, if the users demand those products, don't just give them the cheapest product. Give them the products that are suitable for them. For instance, in the Tamil Nadu government has recently introduced a choice-based system for people who need assistive technology. So for a motorized wheelchair, they give them a catalog. They say, okay, these are like, 10, 20 vendors who make these motorized wheelchairs. These are the products on offer. Now, out of these, you pick what is most suitable for you. Instead of the government saying, okay, I'm going to conduct a camp and give everybody the same wheelchair, they're saying, you choose from this catalog, and then we'll place orders accordingly. And they're allowing even startups to participate in this tendering process, which, see, the startups, for them to sustain, they need business on a larger scale, which only the government can do. So the role of the government is very, very important to enable the right devices to reach the right people. And the government should also do impact assessments. When they give these devices, don't just give the devices and forget about it. Go back and see how it has made a difference in the lives of these people. Only then you will know the effectiveness of the program that you are doing. Whether it is CSR funds are also, being used to distribute devices. So, but this impact assessment is very important, so that you know the impact of what you're creating, what you're enabling, and that will allow you to do, not just focus on numbers. Don't say I gave 500 devices. Even if you're able to first, for the same money, give only 100 devices, if you see the impact it makes in the lives of those people, you will somehow figure out a way to get more funds, so that all 500 people get the same quality of devices. Because quality is important. That focus on quality over quantity and the impact assessment, these are very important aspects, and the government can step in and do a lot of things. Also, the other way the government can help is bring assistive technology under general health insurance. Right now, after the hospital stay, when the person goes out, the therapy, assistive technologies, all those are outside, they're not covered by insurance. So many people cannot afford to, go for therapy or get the assistive technologies they need. That has to change. If they bring this under general healthcare, under the ages of health insurance, whether it's public or private, and make it mandatory that rehabilitation process, therapy, assistive devices, all these should be covered under insurance, whether it's the government scheme or other schemes, then you will see that people have access to these devices. Again, the gap between need and demand can be narrowed considerably by these initiatives from the government. One more point I want to mention, the government has been very successful in this direct benefit transfer and all the schemes, right, for other things. They should do the same thing for assistive technologies, because then the user can decide which is the device that is best for them, rather than getting some device at some camp and then finding that it's not appropriate and not using it.
Has the device been launched in the market? How can people access this device? Find out.
The launch is because we were ready to, all the testing has been completed, the trials are completed. So Mobility India intends to launch it start selling it in June. They'll bring it to the market in June.
Professor Sujatha tells us about the development of designs that are in pipeline by R2D2 at IIT Madras.
So we have about, another 10-15 projects in various stages of development. So many of these, so we are now looking at designing a prosthetic foot that is also, again, see, the Jaipur foot is a wonderful example of indigenous innovation. It's very well suited for Indian conditions, walking barefoot and, durability and all that. But I think there are some improvements that can be made, and we have again done a lot of theoretical research towards that, and we hope to be coming up with a lighter and equally affordable version of a prosthetic foot that is also biomechanically more suitable. See, because we work in biomechanics, we have some understanding of how these devices should perform, and so we'll be coming up with a prosthetic foot. We'll be coming up with both affordable and some high activity. So for younger users, who maybe need a prosthesis because of a motorcycle accident, they have their whole life ahead of them, and they want to participate, to maintain health. They want to jog, they want to be more active than just walking from point A to point B. So we are also working on some feet like that. Those are called energy storage and return feet. So we will be working on those kinds of feet. We are working on orthotic joints. See, some people, like the people who wear those polio calipers, those joints are generally locked, and for some people that is the only solution. You have to lock the joint, but the way the locks are designed right now, it's a little cumbersome to operate. It can get stuck in clothes. It does not reliably lock when they stand up. So when they have to unlock it, say in a public place to sit down, or in a bus, it becomes very cumbersome, especially if they have it on both legs. So we are working on some ways of mechanism to do it more easily, more discreetly, so that people feel more comfortable using that. We are also working on some, maybe the next version of the knee, but that's in very early stages. Something that will say provide, so a person can change their walking speed more easily. With Kadam, it's an adjustment that they have to make. If they can walk at one walking speed, but if they want to suddenly change speed, the knee will not respond, because it's called frictional swing control. But there are some other ways we could design it so that it can automatically adapt to the walking speed. So these are some things. We are also working on more wheelchair related products at R2D2. We are also with CMC Vellore. We are now working on neuro rehabilitation for after stroke. So when a person has a stroke, they have to undergo therapy. And because again, the ratio of therapists to the ratio of the people who need therapy is very low, therapists can't, there's a limited amount that they can do. What we are doing is we are creating devices that therapists can, set up for the patient, and then the patient can do the therapy so that the therapist can give their care to more people in one shot, and the repetitive work is left to the machine. But we are also making it interesting for the person who needs therapy by gamifying the therapy. So as they are doing the therapy, they're also playing a game so that they don't feel like they're just doing a repetitive movement with their hands. So that is another device that we hopefully will bring to the market soon. So I think in the next couple of years or something, this neuro-rehabilitation device with CMC Vellore and the prosthetic foot, these are some of the things that we hope to bring to the market.
Kadam, the most recent indigenous device by IIT Madras, aims to improve the quality of life of users through increased community participation, access to education, livelihood opportunities, and overall well-being. In the next couple of years, the institute aims to bring lightweight wheelchair, prosthetic foot, and neuro-rehabilitation device, among other things, into the market. Thank you for watching. Stay tuned with PBNS for more such stories where technology meets healthcare to make lives better.